Okay, the first question for everyone we're going to discuss is empathy across cultures. So, what challenges have you faced in expressing empathy to clients from different cultural backgrounds, and how have you addressed these challenges? So, I open the floor up to the participants.
Yeah, I would like to share. Like when I was in undergraduate, today I find out several of my textbook, and I noticed that most of them are translated from English textbook. And at that time when I was an undergraduate, and the first challenge I face is I try to read the sentence as a good student. I try to memorize the sentence and speak to my clients, and lots of time they found like so fake, phony, and weird. Like, oh, and in Taiwan, we don't have a word like psychotherapist or psychologist. We only call us teacher. So it's like teacher is like an alien, ET, or so weird, not from the planet. Because and and I also noticed that at that time, lots of my textbook, I draw on lots of question mark. Like I noticed that some sentence especially is from the subject because Taiwanese tend to sometimes we say I, you, but in the textbook, we would say we need to point out to the client to notice them, to own their feeling. Or sometimes some empathetic is like kind of two technique combined. One is reflection of meaning. But Taiwanese client tend to avoid like, don't say I'm angry. Don't say I'm sad. Just repeat my sentence. And sometimes the reflection of the meaning or reflection of emotion tend to make them feel nervous. So at that time, I find maybe summary is a good way. And when they sometimes they say you to mean me, or when they say I, you, he, but the subject change. So I remember at that time, my supervisor told me that she studied counseling from United States, but she told me that when you do the counseling to the Taiwanese, don't repeat the subject. Taiwanese like the subject thus sentence. Just summary. And she said summary is a empathetic technique for Taiwanese. Don't follow the Western textbook. So, so I think that's my first culture shock, a challenge for me from a student perspective, because now I'm still a student, but also a practitioner working with children. S- So I'm also curious about your experience. Like, do
The
you think we
subject,
can,
right?
yeah, the
We
subject
include the subject. You, is it too close, too personal? Yeah.
or the reflection of emotion? I'm curious about like, does that happen in India, Korea, China, or Japan? Because I think some Taiwanese, sometimes we have lots of unspoken, hidden meaning, but when that get point out, we feel nervous. Like, don't point that out. You know, I know, you know, that's everything. Don't speak it out.
You know, I know.
You, yeah.
I guess you know.
Yes, yes.
Yeah.
Yeah, maybe I can add on to Leon's opinion right there. Actually, I'm very surprised about the subject you meant because I'm from Hong Kong. Actually, we are quite similar in terms of culture, right? But in my experience, there is not much challenges related to subjective all the subjects we mentioned. However, I agree that, in terms of the emotions, they might be avoiding those kind of emotional response as well. However, they are not that reluctant. It's just they were not aware of their own emotions. So we might need to be more aware of their nonverbal cues, or if we can have some verbal tracking to see what they are saying in order for us to so-called guess their emotions. At the same time, because we can't really assume that the emotion we think is related to their experience, right? So a lot of time I will have to use a lot of clarification micro skills in order to know more about if, the feelings I assume is really what they are feeling. So it is actually quite challenging for us to know more about their experience because they can't really tell us about their emotions. Most of them will talk about their cognitive thinking when we're asking some questions right there. So yeah, there's some of the similarities between Hong Kong and Taiwan, I guess, and at the same time there are some different behaviors, from our cultures as well. That's very interesting, though.
Mhm.
I could add to that because it is interesting in the sense that in Japanese, in sentences, we omit I or you or who it is. So, sometimes saying I is too much. It's like overemphasizing you, and it's not considered to be sophisticated. And when people talk about the emotions as well, they said, well, I mean, they don't talk about who was angry, but the air or the ambience was, more angry tone. So emphasizing who or you, like I am angry, is considered not so too polite or sophisticated. So in Japanese conversation, a lot of people, or like, sometimes with even clients, you ask who said this or who was angry? Because you're unsure, from the speech, even to Japanese people. So a lot of techniques around reflections of emotions is very artificial and it's awkward. But as the therapy progresses, the clients get used to it and they benefit. But there's still some kind of culturally, not very fitting aspect to a very simple questions about what are you feeling or I statements.
Mm.
I
Yeah,
could also,
me
please go
first?
ahead. Please go ahead.
Yeah. Yeah, I would like to discuss the characteristics of Korean counseling and psychotherapy first. Korea is a place influenced by Confucian culture and has a tendency toward collectivism, but I feel that it has become increasingly individualistic due to the influence of Western culture in recent years. But nevertheless, Korea has a culture of filial piety and Han culture due to Confucian culture. Han is a kind of emotional lump that is kept deep in the heart without being expressed. And sometimes it is expressed as a somatization symptom. In this way, Koreans have the characteristics of not experiencing emotions well, I think. So in fact, in a study conducted on Korean master counselors, the three most characteristic features of Korean counseling are as follows. First, the counselor knows and waits for the client to express his or her problems and emotions verbally in the early stages of counseling. And second, the counselor knows about the family-centered parent-child system and treats the clients as if he or she were their child, like child. And third, the counselor utilizes emotional bonding in the relationship with the client. These research results are also consistent with the results of the study conducted the following year on counseling major clients. Of these, three are as follows. First, counselors are aware of the client's slow rate of emotional awareness and expression and respond accordingly. And second, counselor play a nurturing role like parents. And third, counselors have a human interest and deep affection for clients. So I think considering these characteristics of Korean counseling and psychotherapy, the characteristics of empathy in Korean counseling and psychotherapy can be listed as follows, I think. First, Korean clients may take longer than Western clients to express their emotions in words, I think. And second, they empathize with a caring attitude as if parents were raising their children. And third, they utilize emotional bonds within relationships based on deep human interest and affection for clients, I think. So it's a little bit similar to other countries in Asia, and I think some of them is somewhat different, I think. Thank you.
Yeah, so there's really the similarity of some difficulty in expressing emotions. I'm also very intrigued by the parental figure role.
Yeah,
Yeah,
sometimes, yeah.
that is something new to me too. Like how do we, whereas Rogers would say collaborative, right? So there's more um almost like hierarchical, almost. Yeah.
I could come in
Yeah.
here. I wanted to respond to the previous discussion about I and you. But I mean, this is also very interesting. And I was thinking about how to talk about India as a whole, because we're so multicultural, right? And I looked at all the different stances that people take when they talk about cultures. And one of them that really resonated with me was about recognizing what are the similarities and differences, and then sort of enhancing, and so maybe looking at what are the stable factors that facilitate or hinder the therapy process. I'm going to kind of speak from that perspective rather than speaking for India as a whole. So that's one of the things. So coming back to this, I find it really interesting because when I started, I mostly practice emotion-focused therapy now. And there's a whole lot of chair work which requires you to differentiate two paths in you and I. And it was really daunting and very difficult because all the textbooks, talk about how you have to speak in terms of you and I, and it has its advantages, and I can see the the use of that, but at the same time, the language that I speak in India, it like Shigeru was talking about, it's very awkward actually, and it doesn't fit the context many times. So I started relying on non-verbals, and to really see whether the emotion is activated, and whether it requires that additional nudge or not sometimes, and then take a call based on that, and then see what. So everything was, I feel like it came back to being very moment by moment and process oriented to really see what's exactly happening, and then intervene in that way. And sometimes it's just not possible to speak in terms of I or you. And when you can see that it's, if the emotion's active, even if they're speaking in third person, then I think it's absolutely fine to let it go. Another one, I think when we talk about like labeling emotion, then maybe it becomes a bit kind of awkward, or maybe like 3 steps forward rather than 1 step forward. So I find it really important to sort of see what is the next step forward, and that might be the nuances of what has been spoken. And that many times is not just you're feeling angry or you're feeling, sad or shame or whatever that is. And another one that I find really interesting, because in EFT we use a lot of evocative empathy. that sometimes I just don't do that because it feels like maybe my therapist is just exaggerating too much, and maybe they can then kind of take 3 steps back and feel like, no, this is too much, or shut down. So that's another interesting one that I was thinking about. Yeah, and coming back to the parental part, I also wanted to say a little bit about the expectation to be the expert in the room, which is very much part of the Indian culture, that there's a whole lot of expectation that you're going to solve my problem and tell me something, guide me to what I can do. And and that's really difficult to navigate in the beginning, I think, as an early career therapist specifically, because it brings out all these sort of from my practice from the beginning to now, even as supervisor, I see there's a need to rescue maybe a sort of helplessness, a whole lot that can prevent the therapist from kind of keeping that stance of being maybe person-centered or experiential and then go into problem solving or fixing. And that's very interesting for me. I would love to know more about what others think about this.
May I add on to what Simran said about the hierarchical relationship, or the relationship between the client and the therapist, and that kind of like not knowing stance of the therapist in some orientations is important. And about that, I feel like in Japan, many adults are living in a society where the hierarchical relationship is the norm. That's the framework that they're living in. And so when they go into the therapy and suddenly there's a shift to more of a horizontal relationship, I feel like it might off-put them, or they might feel like this sense of stability that they had is gone, or they might feel maybe not as comfortable. And they might also, I feel like they might start thinking like, oh, maybe if the therapist is acting too like more on the equal position, then they might feel like, oh, is this therapist professional enough, or are they taking me seriously? And so I think there's this very like subtle and complicated dynamics of the hierarchical position and how you use the language of honorifics, and whether you're younger than this client or older, or are you a female or a male, all of that like plays into which words you should use. And so I don't really have like a solution for that, but I think that's like one characteristic in Japan that plays a role in therapy sessions.
I wanted to respond to what you were saying, Marina, because this is just what I was thinking about, that often when we talk about culture, we tend to position it between, this individualist and collectivist, but there's so many layers within the culture. I mean, just India is, of course, an excellent example. So earlier, I think I used to think of it like this, like in terms of broad brush cultural differences. But more recently, and I found that quite helpful, that rather than calling it culture, just look across the intersections. So whether it's age, gender, class, caste, which is relevant for us in India, ability, your relationship status, like everything, and even the region you come to, the language you come from, or the language you speak, or whether you're literate or not. I mean, all of these things, they combine together in a very unique way. And to me, like that way of looking at culture, I found it much more useful in my practice now. So there are all these elements of who has more power, less power, how much distance do you need to have, how much closeness is permissible or comfortable or uncomfortable. So that sort of positioning tends to happen. And I think we're aware of it. Of course, it's more complex than just saying X or Y culture, but I think it allows for a more nuanced entry. And our clients are doing it all the time. So one of the common questions that many of us as therapists will be asked by our clients is, what is your native place? So they want to know, like, where have you come from? Like, where are your family roots? Even if you're living in, Bangalore, for example, but where do you come from? So it's their attempt to try and position you and see, like, how is this relationship going to be, and how do we connect? So, I mean, I think both are doing it in the room. So perhaps some sort of dialectic between the knowing and the not knowing. Like you were saying, Marina, that not knowing stance is so important. I absolutely agree. But some amount of knowing, some amount of effort on the therapist's part, that I'm going to see my clients across these diverse intersections. What do I need to know about their experiences? Maybe not fully, but at least something, so that then I can balance the knowing and not knowing. And then that perhaps creates a little bit easier space for empathy to keep evolving. Like you said, Simran, no, moment by moment, it will just, be that way. So sometimes it can be like the simplest of things. So for example, one of the other ways that people greet each other in Bangalore is by asking, no matter what time of the day or night it might be, have you eaten? So that is, instead of like good morning or afternoon, you'll be asked uta aita, or like, have you eaten? So sometimes if you feel your client is from expecting that sort of interaction, you may do something like that just to create some sense of sameness while acknowledging that, there's lots of not knowing in the room as well. So sometimes it's just the tiny things rather than going fully prepared. So yeah, that's what I wanted to share.
I mean, I think that, maybe this thing that Marina is talking about, I can see that now. I'm much older. I'm getting older, and also that the fact that I was now I moved to another university, but I was a professor at the National University. So that really come into play when I use even a simple empathic comment, because the client thinks, wow, this someone with the power is trying to show me this, kindness. So it feels great. So, this is not really like I'm trying to facilitate exploration. But the client feels flattered, client feels affirmed. So the whole process of empathy is blocked because of the power difference. In the opposite way, I think Marina's talking about the, how that works in the opposite way. If you're a student, your way of, your perfect empathy, according to, emotion focused therapy, may not reach the client, because the client may think, who do you think you are? You're a student, and you think you can understand my emotions. And that's sort of the power difference. So not the power difference so much, but just the social assumptions about who you are and where you're ranked. I think that really kind of plays a lot more. I mean, I'm sure it plays everywhere, but I think in some situation, also, I think what Simran's talking about, it kind of blocks the assumed mechanism of change or relationship building through empathy. And something else starts to, set in operation.
So what I'm gathering from the different speakers is how we really need to pay attention to the social aspect, not just
Right.
not just the theoretical in terms of psychotherapy, especially if we are trained in the West and use Western textbooks, then there's a lot more emphasis of not knowing, right?
Right.
Whereas we may need to show some knowing to get the, them to get the buy-in to the relationship and feel more comfortable, because that's the expectation of the client.
Yeah. It's not only lost in translation, we added, in translation, or transformed in translation.
Yeah. We don't need to see it as a lost, but really expanding how we see people.
I also just wanted to add, what I'm also getting from this is balancing the power dynamic can either be about being able to establish credibility as, say, a student or someone coming, starting off as a therapist. And on the other side, this person's very senior, has a lot of experience, and then can tell me what to do, or then, that blocks the explorative, experiential aspect of it. So how to balance both. So that's really useful. Thank you.
So maybe that would be a good transition to the next question, right? I think something that we gathered is that the expression of emotions can be quite commonly difficult across the different Asian countries and cultures. So how does training can help? One of the questions that we prepared earlier on is, what strategies or training methods can help therapists learn to adapt the expression of empathy for clients from diverse cultural backgrounds. So maybe in terms of empathy across expressing empathy, but maybe more specifically about, exploration of emotions, since it seemed to be quite difficult. And we have some experts in EFT here. So I really want to learn emotion-focused therapies and how you use that in an Asian culture where it is typically more difficult.
Okay, let me start first. As I mentioned to you before, the characteristics of empathy for clients in Korean counseling and psychotherapy practices are very similar to the spirit of the EFT, I think, which I consider to be my main theory. In particular, the most popular counseling theories in Korea are psychodynamic therapy and person-centered therapy. And considering that EFT is a theory developed from person-centered therapy and Gestalt therapy, it can be seen as I think, being similar to Korean cultural sentiments, even though this is from Western culture. So when I supervise and train in my students, I teach them on empathic attitude based on the spirit of EFT. EFT, which takes a humanistic perspective, can be seen as a spirit that is similar to the deep interests in humans and the deep understanding based on this that many Korean counselors have, I think. So when I teach students about sensitivity to empathy, I focus on EFT's empathic attunement, such as empathic affirmation, empathic conjecture, empathic following, empathic reflection, and evocative exploration. In order to understand the client's core sense of self, I think we need to form a therapeutic relationship with this sympathetic attunement attitude and resonate with and deal with the client's deep emotional pain. I dare say that this EFT, empathic attunement attitude, is a more sophisticated theory that goes beyond the achievements of Carl Rogers, the great founder of person-centered therapy, whose core spirit is empathic understanding. I teach this empathic attunement attitude to my students as a core. So I would like to talk about my comment by mentioning a few expressions from Dr. Dong-sik Lee, a prominent Korean psychiatrist who passed away a few years ago. He defined psychotherapy as bringing spring to a client shivering on frozen ground with the therapist's warm personality. So I think that the therapist's warm personality is the therapist's character who can form a therapeutic relationship with the client with the empathic attunement attitude. He also said that the root of all mental disorders is the absence of empathy response. I completely agree with this statement. I think this is not a simple reductionist viewpoint. I believe that this means that empathic responses are essential in the world of human relationship, even though several cultural differences. I plan to, so I plan to continue teach this spirit to my students in the future. Yeah, thank you.
Thank you. So it really starts from the attitude, right? It changes how we see things and how we, then learn the skills, but, still holding on to that value that even though it may be difficult to express or difficult to get the clients to express emotions, but we try to stay with them. That's what I'm getting from the attitude piece.
Mhm.
Maybe I can add on the attitude part. Yeah, so I really agree that actually, how can we teach our supervisees or our students to be more empathetic or to address the empathetic understanding across cultures? We have mentioned about not knowing and knowing just now, right? Of course, we have to be adopting the not knowing position because we can't assume or we can't um, uh, um, uh, persuade or convey our understanding to the clients. But at the same time, we have to have the knowing part. If we can know about their cultures or what they're expecting, so we can get the similarities or sameness to get the empathetic understanding, right? But at the same time, I really think that attitude, what Youngkeun mentioned, is really important as well, which is it's not only about the attitude, it's about the vibe or the personality we have. So when I'm teaching my students or supervisees, I'm not only teaching the skills or the micro skills or the counseling techniques, how do we adopt the not knowing attitude, or how can we reframe our sentences or questionings. It's about how we can develop our own vibe and in order for the client to feel the warmth Yang mentioned. So the warmth is not only about the sentences we mentioned, it's about what we behave and our etiquette and our counseling psychologist or counselor's identity. So I'm trying to focus more on how I can demonstrate the attitude or the identity to the students, and in the supervision process, they start to know more about how a counselor should be. So during supervision, I really try to use the counseling perspective in order to supervise the students and let them know what a counselor or a counseling psychologist should be. And it seems like they are more adapting to this identity and they are able to be more empathetic, no matter if they know about the culture of the clients or not. This vibe will let them being closer to the clients afterwards. I'm not sure if I'm explaining clearly or not. Feel free to let me know if there's any unclear concepts.
I guess what you pointed out is really important in terms of modeling. Some of it has to be experiential, right? It's really difficult to lecture or talk about the different points of how to do empathy, but really, if the trainee experience it from us, then I think it is more powerful, and hopefully they can carry forward parallel process, whatever you got.
Yeah, that's very
Yeah.
important. That's the parallel processing.
Mhm.
Can I come in here? Just also, I think, Adrian, what I got from what you said, which is so important, and I wanted to emphasize, was about like the curiosity, whatever culture your client is coming from, like avoiding any judgment or stereotypes, and just, adopting that attitude kind of brings in that sense of curiosity, and then there's less chance of empathic failures, maybe, when you do that. And to that, I also wanted to add, so this comes from, not from me, from Robert, one of the founders of EFT. So they talk about, and there's a whole lot, like Youngkeun was talking about communicative attunement in EFT, and there's so much there. But Robert recently, talked about situated empathy, which I found very interesting. And so it's so they say that it's not just about the communicative empathy that's so emphasized in EFT, that it's also about offering empathy, not just to the present moment in this situation, but also to the client in their life, where they come from, what it is like to be them, and kind of going beyond the present moment and understanding the larger sociocultural context. And that can then inform your communicative attunement and empathy. And I find that I got so lost, learning EFT and mastering all those, micro skills, that this overall really helps me to see it as a whole. So I just wanted to add that. Yeah.
That's a really valuable comment, because there's such a focus on moment to moment interaction, or the emotional expressions emphasis. But you are saying that we should also, to really have an impact with our empathic statements, it would be much more useful. I mean, much there will be much added value to also look at the overall picture, where they came from, to really understand where the clients feel situated.
I mean, I call that more existential affirmation, because it's not so much of empathy as much as affirming the client existence. Where you're born, how you came about, and why, the whole sort of existence. And it's not so much of empathy, it is certainly like trying to understand, but it's more affirming,
Mm.
who the client is, and with all the contextual, historical being, or,
Mhm. So it sounds like the understanding can be broadened or deepened by taking into account not just how they are presenting in the room, but also, the overall picture, and affirming their being.
right. And I think that in Japanese context, I think that when we do EFT, we do that a lot.
Mm. How do you do that? Like technically, like I don't know.
Yeah, I guess that, I mean, that the people suffer not because they wanted to do, or, it's their fault, but it's just the situation that they have had to be in.
Mm.
And it's not really, someone's fault or anything, but it's just happens, So all these things that come into play, and
Mhm.
so, in order to show the understanding of not just moment to moment emotions,
Mhm.
but just who they are, and, affirming the fact that, everything led up to, where they are.
Mhm. So almost like turning some of that self-blame and self-criticism outward.
Exactly. And also, I guess you could say, affirming the defense or all the effort that might have failed, but they made to survive and to up to this point.
So it's like a really deep understanding, like Shigeru mentioned, existential affirmation. And I work in the court for several years with child custody issues. And I find that not just for children, at first I do the play therapy for children, but I find out sometimes it's so difficult for parents to say something, and maybe I'm younger than them. So it's even more awkward for them to say something to like my age, maybe like their cousin or nephew. So I find that at that time when I bring the toy box for them, maybe it's difficult for them to say, but they can pick the miniature of a witch, or they can pick a miniature of king, queen, or orphan, or Beauty and the Beast. And I think, or cage, or stonewalling, something like that. It's like nothing spoken, but also everything is spoken out. So that get a chance to understand their unseen and unspoken, and kind of like in play therapy, we say the toys are the vocabulary for children, and the play is kind of language. And I find that sometimes maybe for adult, that kind of like you guys mentioned, that kind of affirmation is like we kind of give them a bridge to give them some vocabularies, especially those emotional vocabularies are really awkward in our hierarchical background. So if the therapist being knowing and considerate, thoughtful about that, but also give them the freedom to choose, give them the space to wait. I think that's yes, and I do that by nonverbal therapy, like art therapy, play therapy, and Trey.
So
Yeah,
here
but I also learn a lot from you, so I take lots of notes, like steal some of your sentence. Sorry, keep going.
No, it's great. Then we can call the existential affirmation as more transcultural,
Exactly.
intervention.
Yeah, so maybe expressions of emotions may be less direct in some cultures, but there are ways around it to get at where it feels more comfortable, or at least, it can scaffold the deeper emotional exploration later on. Great. What about language? I think one of the questions that came up earlier on is, how does language, particularly the use of honorifics or the tone or being formal versus informal, affect the way empathy is being expressed and received in therapy across cultures? So do we be more formal because of the hierarchical relationship, or is it, still people dependent? Yeah, client dependent.
I think this is a very interesting question. I'd like to know more from other countries, because in Japan, you change the way, I mean, the verb ending, depending on you are talking to your senior or, someone of your same age, or someone, your junior. And also the distance, or the kind of the closeness, also influences the way you speak quite a lot in terms of the expressions that we use. That makes some of the sort of interaction in psychotherapy very formal, almost too formal to allow free kind of emotional experience in the session. And, I mean, in the beginning, as a therapist, we tell them, this is where you should be able to speak more freely, and everything.
Mhm.
But still, the language issue is always the issue that we encounter. I wonder what that is like in another country.
Mhm.
Wait, before going into other country, can I add that the formal language that we use here in Japan, I feel like it's not just creates distance. I think
Mm.
there's like it has an aspect of like person who's talking to someone senior to you use that language, and I feel like there's a feeling of like, please take care of me, or like I'm under you, like, and there's a relationship of like the senior will kind of take care of you. That kind of hierarchical relationship is also created by the formal language, use of formal language. So it's not just distance. But yeah, I want to hear more from the other countries if it's similar or different too.
So it's not just respect and deference to someone higher, but also wanting or indicating or implying some kind of protection or being taken care of. Mhm.
But not using it means some kind of disrespect
Right.
or challenge.
Yeah. Yeah.
So,
Poornima.
it's so interesting to listen to this because I was trying to reflect what do I usually do. And I think in the setting that I work in, I would tend to use the cultural default to begin with. Like if I am seeing someone older than me, particularly I think age, it plays out a lot. So older than me, I will begin by using the language of the cultural default and then find that in our relationship, how do we move? And I mean, even if that language continues to be used, but how do we create a different dynamic in the relationship? However, if I'm seeing someone younger, like a teenager, I don't want them to use the cultural default with me. So I work very hard right from the beginning to like address that, to use language in a slightly different way, to put it out there that this is a very, very different relationship in terms of, that power hierarchy in so many ways doesn't have to be maintained. So I think I do it differently when I see someone older and younger. So, yeah.
Yeah, I want to add on Poornima's point. That's very interesting to relate on the age difference. So it's not only about the nationality or ethnicity culture, it's also about the age. And I would also include not only age, it's also about our background as well. Because I want to have an example. For example, there was a counselor trainee who was a teacher before. And actually, different career background while we were training, actually we developed different kind of communication patterns or etiquette or our way of speaking. And yeah, of course, the counseling trainee really want to establish the equal power difference with their clients. However, she was not aware of her cultural or career cultural background. So she was using some sentences as a teacher. And then at the same time, her client was also a student or a high school student. And that also creates the distance feelings between the clients and the counselors. So while we are doing the supervision, we found that out and we try to change a bit our etiquette or our sentence structures. And boundary setting is different. And the client can really feel the empathetic response from the therapist. But before, actually, she also did some reflection of feelings, but still the client was not able to feel that empathetic understanding, right? So it's also about our own awareness of our own background. It's not only about the age differences or the nationality differences, but also how we raised by our family or our career background or other different environmental factors that affect our own personality that also we need to be aware of, I think.
Yeah, and so even outside of therapy, say me with my students, some have no problem me calling me by my first name, but some even after multiple encouragement, oh, you can call me Harold, but they cannot allow themselves to say that, so they will go Professor Chui. So, so I think you raise a really good point. It's not really culture. I mean, it's not just a cultural as a group, but also individual, family, how we are raised. Yeah. But it does have some implication on the relationship in terms of the distance versus closeness. But there's also perhaps there's some I don't know, preference for more distance relationship is more personality too, right? Yeah.
Right.
So
Yeah, I also agree. And actually, this kind of, for example, distance personality, we can also use some therapeutic framework to understand these underlying needs. It's not only about the counseling dynamic or the therapeutic alliance. It also represents some of their internal struggles that also I think the therapists also need to be aware of based on their own therapeutic orientation.
right.
Yeah. And like just I'm speaking for myself. I speak differently, quite differently, just personally, or like when I have to speak more politely. And there are a lot of like there's a big gap, experiential gap there. And I think as a as a therapist, we would like to do something about it. If we cannot completely take that away, because it's the therapy is still a social situation, but it seems like there's a lot of kind of facade that people need to put on in therapy. Especially in Japan.
Facade for the therapist or client or both?
Both.
Okay.
I'm not sure how other people think about this.
Yeah, I'm just thinking about, when you say facade, it feels like putting some distance in a way, preventing each other from knowing the real, us. Yeah. Maybe it's a good time to open up to the audience. If anyone who have a thought to chime in and share your experience in terms of, distance or empathy across cultures, the language.
Can I go ahead?
Yeah, sure.
Hello, everyone. I'm Kiran. I'm a PhD scholar, clinical psychologist. And the last part, which was mentioned as the language, I just want to share my opinion in that. I feel as the language from the therapist perspective is greatly influenced by the how you're trained, the techniques and application. I think, uh, in my observation, because of the kind of training you've gone through, and that is a majorly translated from the therapist to therapist. And if there is very less accommodation for the cultural element into the techniques, and so language is influenced there, and the expression of empathy by the therapist to the client, it is completely becomes on techniques. how they have been trained. Is what I sense right now. That is one thing on the language which I observe. Uh, the other thing which I would like Poornima had mentioned earlier about the layers in the culture, gender and everything. Also, I'd like to bring this that component of distance in that, where in my experience, I've come across people in India, at least the distance is like the first thing, the expression, and wanted they established this hierarchy by coming and touching the feet, saying that you're the higher end outside. That is a communication they would like to express, showing that. The hierarchy that you're a therapist, we would like to you protect us. That is a communication because most of it expresses in a non-verbal way, which is the which is more predominant in non-verbal and verbal element goes down. That becomes really challenging for a therapist. I have until date I have experienced that it becomes verbalizing that becomes difficult, but they showcase in a non-verbal more in at least in my experience. That's what I would like to share. Thank you.
Yeah, I think, yeah.
Can I say something?
Yeah, sure.
Yeah. So I work in a university setting as a counselor, both for faculties and students. So in terms of the language and the way I have to interact with both these different levels is significantly different
Mm.
because the faculties kind of don't look at me on par. For them, we are the non-teaching people in the university campus. So they are hierarchically at a slightly higher level, is what they think, they perceive the relationship, whereas the students are hierarchy little bit low. So, the nuances in the language to establish relationship and to show that we are with them has to be done a little different for each of them. And also here, as Poornima mentioned, and the person, I didn't get his name before me, in India, there's a lot of language barriers, ethnic and within that caste and ethnic thing. So it is very easy to establish a rapport. So if I'm a Brahmin and and I speak the same language, it is more easy for me to establish relationship with such a person than uh, the culture where I am. People speak more Malayalam and they are Christians. So for me to establish initially a relationship with them takes much more longer time.
Mm.
So language, ethnicity, within it, I do not have to go to another country, but within my workspace, every day this is a challenge for me because the students there are from all over India. They come from northeast, come from north, they come from central India, they come from south India, but a predominant group of them are from the state of Kerala, because the institution per se is a minority institution which is affiliated to the Kerala Syrio Malabar Church. So it is really a challenge, and that is why when I saw this topic, I registered to be to listen to you all. Thank you.
Thank you. So it's not just hierarchy, but also different regions, how easily or quickly you can form the working alliance with them, and the closeness, also the emotional bonding. Yeah.
I just wanted to step in to say that I'm hearing from a lot of people that everyone is experiencing a certain gap in the training phase itself. It's almost that, you do your training, and then when you get into the real world, so to speak, then you have to figure out all of these things. And it makes me wonder, what are some of the things that we can try and introduce in training itself, and what are the ways in which we can do it, so it's more experiential and not just another set of facts and comparisons. So yeah, I hope that some people here may have some thoughts on that as well.
Yeah, when I teach, I try to highlight responsiveness, because no one thing works for everyone, right? So it really depends on, whether you are responding to the client's culture, and if they have a difficult time calling you by your first name, then don't don't have to force it. And if they prefer to maintain some distance, and you may keep trying, but respect that is the distance that they would prefer to. So responsiveness is one thing that I try to highlight, and as an attitude, as an overall overarching theme in terms of not just in terms of expression of empathy, but also your verbal responses, how closely you sit, even if you want to put your chair closer, but if they're backing away, then okay, back off. Yeah. So Marina.
Yeah, about the training and the gap in training. I wanted to talk about my experience of studying in liberal arts college for 4 years undergrad, and then coming to a different university for my master's, and that university is not liberal arts. So whoever that got into the psychology department, they would only study psychology. I think they would only study psychology and go into clinical psychology. And I felt that because of my liberal arts background, like we studied privilege, and people who have privilege, we don't really have the experience of learning about others who you just don't realize the experiences of people who have less privilege than you. You don't, oftentimes you don't get the experience of learning that. So I feel like as a clinical psychologist, just learning psychology or just learning skills is not enough, that you should have the opportunity to study like a wide range of field and social problems and history, and because I think that's really important as a clinical psychologist.
To read broadly and know about the people are so diverse and different, and knowing some systems and privilege versus oppression can really help us to stay open.
I also wanted to come in here also, like Marina, what you mentioned sort of reminded me of looking at our own blind spots that we come in with as therapists, and how to address them, how they show up with clients from different backgrounds, and then what we can do to sort of maybe not prevent them from happening, but when they do happen, then how to sort of allow space to have conversations about it and work through it outside of sessions, and maybe educate ourselves about people's backgrounds that we don't know much about, something like that. And Harold, I also wanted to add to your point about responsiveness. I was, when we were talking about language, I was thinking about this as well. And one of the things that I have learned, especially now as a supervisor in training, is some concepts from conversation analysis that are kind of taken into EFT, and how there's so much emphasis on and this whole point about the facade, right? And how do we be able to show up as authentic, congruent in the relationship, despite everything else that's going on with the different backgrounds. And one of the things that I find really useful is, how do I acknowledge my own experience in that moment? That maybe as a therapist, this is uncomfortable for me, that somebody's giving me, so much respect, or or not seeing me as credible, or so being able to acknowledge my own experience in that moment, so I'm able to stay congruent and authentic. And even in terms of emotional warmth or distance or closeness, of how can I be myself and still be able to sort of adjust that to the cultural background. And that's from the therapist side. And the one from conversation analysis is about constantly looking for client hesitation and what we call pre-disagreement or disagreement, where when there's a lot of deference, there's, the client may not say, no, that's not what I mean, but they may say, maybe, somewhat, and then, sort of change that. And it's so important to be responsive to that and say, oh, okay, so that's not what you mean. That's not this. It is this. And sort of really look at these hesitations and pre-disagreements as that maybe it's deference and they're just being polite and working with you, right? Yeah.
Yeah, I really like that. That's really concrete way of how to pay attention to some of the underlying messages that they're not saying, the clients are not saying, but not skip over that. Yeah.
So that makes me think of the alliance ruptures. There are a lot of withdrawal ruptures, right? I mean, not the confrontation ruptures, but the
Right.
withdrawal ruptures. In Asian culture or in Asian, with Asian clients, I think we need to look at the politeness, rupture. Sometimes the clients are overly polite and and also different. It doesn't mean that they are agreeing with you or the alliance is working out, but it means that they feel constricted to play obedient, good client. And I think that that sort of hesitation and the markers would be very interesting to look at. Yeah.
It's almost like the therapists need to be really aware of how their own culture this or communicates this kind of disagreement.
Right. The sort of, the ways that culturally appropriate way of disagreeing, which hides the fact that they are disagreeing.
Yes, that hides it. Any other thoughts on training?
I would like to add something on this.
Sure.
Yeah, so one of the things that I was also thinking about is with regards to letting paradoxicality sort of enter the therapy rooms with the client and also with the supervisor. Like the minute I think of my supervisor and I have an open door as a mental image that comes to me, it means that there's also some form of transitory okayness that I take away in being a person, and also where this kind of supervision takes place. And because this is also something that I sit with my client in the therapy room. So when I was in my training years, the needs with which the client came with their own stories, with their historical context, it sort of gave me a very troubled picture of, is it the troubled society or is it the troubled person? And then over time, I remember that this one person used the word jhal modi, which means puffed rice, basically, at its core, which is an English translation of this loosely Bengali word that they use. But when I was sitting with her, I suddenly remembered that this word in the same language versus in the native language produces a whole lot of socio-historical context there. So the puffed rice in English is just something that I eat, which is an edible, as opposed to the client who uses the word jhal modi, which is a whole sentiment, the whole characteristic of a state. And I'm just like, okay, so are we looking at a troubled society or are we looking at a troubled person? And then the activations of, being the savior over there, perhaps, like being the person who's sort of like able to evoke these responses there. And then I remember that when I went to my supervisor, she told me that you don't have to compete to be a very good internal object. Like you can never be the best internal object for the client over there. So this kind of paradoxicality also made me sort of realize that the transitory okayness also comes with not just what is spoken in the supervisor's room, it's also how supervision is accessible somewhere and how do you let this sort of fall with your client. And this is where I remember how Robert Frost says, the poem, we sit round in a circle and the secret sits in the middle and it knows. So somewhere, although the secret sits in the middle, finding ways to access the secret in a way where one is also curious and one lets sort of like sharing language and sounds. And as long as I'm learning and as long as my supervisors, as long as the environment that I am in, as long as the structures open these spaces for dialogue, for more exercises where interaction takes place, I'm willing to see the person in front of me not just as a client, but also a familiar stranger, like the whole thing over there. So this is something that I've been thinking a lot strongly about, because when you're in training, it's a very fast-paced world, but also like pausing and thinking may not like give you that much access to everything alike. But then what are these reflections, when do they spew on, and these circles, and how do we sit with these circles across groups? So something, yeah, this was something, I don't know where am I going with it, but I'm just trying to put it together that at the end of the day, it's very like circumambulating on different themes. And yeah, it's going to fall on these languages and sounds and some sort of curiosity towards knowing more, towards like also situating oneself with what one knows, and then also falling upon the lines of there is no there. So every moment is becoming sort of like an interactive process of what's now and adds up to something big. Yeah, that's about it.
I mean, I really like listening to the idea of supervision as creating that open, reflective space where one can sometimes meander and, stay uncertain and, talk about differences and sameness. So I think there were many important things that you shared, but I think this is the one thing that really stayed with me.
Mm-hmm.
So everyone can be like a familiar stranger, like in supervision, in the therapy room, in the training process. So that was really interesting.
Yeah. Yeah, it's a good reminder for the supervisors in us, among us, to open that space, because supervisors have a lot of power too, right? If it would be difficult for trainees to initiate that space, but how supervisors can be more inviting for that process. Yeah. Great. Maybe we can run through our last question, right? So the last question I had prepared earlier is the identity, right? So how might a therapist's cultural background or identity affect our own ability to express empathy in culturally appropriate ways? And how can we mitigate some of the potential biases? Well, I guess I'm not trying to force people to self-disclose a lot, but but in terms of cultural identity and how may we, interfere or, facilitate the process because of who we are or how we are raised even. Yeah.
Yeah, I would like to I would like to share, like, in Taiwan, lots of cross-country marriage, like maybe the wife from Taiwan or the husband from United States, or vice versa. And like me, obviously, is like Taiwanese space. So sometimes when I'm in the counseling room, I find like maybe the like couple, one of them from another country, maybe they're kind of like it's 2 to 1. So for them, it's like a guest, or like they are forced to be here. So for me, like I need to be really open and to invite them more. Like or otherwise the dynamic may be like unconsciously not fair for someone. Yeah, so that's one thing I've noticed. And the other thing that is uh because I work with some transgender client in our counseling center, and like at first our counseling center have a restroom toilet for men and female, but after they coming here, now we like take off all the signal. Like now we only have a all gender restroom, and I think for them it's, and also the some sheet For them, at first, the blank is male, female, but now we also have one blank they can fill by themselves, or the pronoun, something like that. Or even for some Taiwanese, because Taiwan rents a lot, sometimes I think for Taiwanese people, they don't want to take off their shoes, but our counseling center need to do that. So I think that kind of identity thing, sometimes it can be shown in a really behavioral way, like action speaks louder than words. And maybe I didn't speak something really loud, but I just email them and ask the counter to email them, notice them. In our counseling center, we need to take off our shoes, so they can prepare something easier for them to take off shoes. Yeah, something like so. That's my experience. But a more action way to notice my identity, or to notice some unsaid unfairness.
Yeah, and I also resonated with the couples work, right? There may be, because of the cultural similarity, then the couple may, well, one of the couple who's similar as the therapist culturally, they may expect you to side with them, or that's really challenging.
Yeah, and sometimes the couple from another country, they would say something like, "Do Taiwanese think that way?" Or is that real?
Oh.
Or is that real? Or do Taiwanese men, do Taiwanese women? And I think that's also important in counseling room, to turn that into kind of intersection, like to notice that kind of intersection, different variables, or different, like, lots of things just happen, maybe for him or for her, not all Taiwanese.
Yeah. So sometimes it's forced upon us to reflect on our own
Mhm,
identities, not,
mhm.
yeah.
I want to add on another point here regarding our therapist cultural identity. And actually, it's related to what Leon mentioned in the first question. He mentioned that, oh, in our Chinese culture, that, oh, a lot of clients might be very reluctant to talk about some of the feelings. Oh, don't say about that feelings, don't say about that feelings, right? And actually, it also affects us as a therapist, because sometimes if we fear of saying those emotion wordings, or other negative thoughts, or some negative events, we fear to confront the clients corresponding to the therapeutic approach. For example, CBT, let's say, maybe we will be having difficulties to confront their cognitive distortions, or for acceptance and commitment therapy, maybe it's hard for us to raise their awareness about their experiential avoidance and etc. So it's not only affecting clients not revealing their own emotions, it also affects us not to raise their awareness or to confront their emotion as well. So this is one of the thing that is related to our empathetic response, because sometimes confrontation is a kind of empathetic response as well. It's not only reflection of feelings and stuff, right? So this is also something that I want to raise too.
So our own comfort with talking about emotions and bringing it up. Yeah.
Yeah, I want to add on about the identity. I think the role of identity is important in empathy. That is because it will soon become the therapist's own way of understanding the client, I think. However, when we consider that the definition of empathy itself, it is to understand the client's identity. It is ultimately about understanding the client's identity based on the therapist's identity. And I think that it should be understood within the client's reference system, not the therapist understanding system. So I think that is what we should strive for. Thank you.
The intersection of identities. There's a comment in the chat box that also speaks to how therapist identity have an impact on the relationship with the client as well. Any thoughts about how we can increase our own comfort with, let's say, if we have difficulty with touching on emotions, or seeing this in our trainees? How can we encourage them to be more open? Yeah, because we are talking about, years of upbringing that may have, interfered with the process, right? So as trainers, we may have to go uphill, so to speak. Yeah. Any thoughts?
I remember one time when I was in the training room with my, I came back out of the session and I was writing my session notes. And I felt like, okay, I had the entire session in words and it was put together. But for some reason, it did not make sense. How can I have all the pieces of another human person in an imperfect world? That's just impossible. And then eventually after that session, I started to ask myself, what is it that I'm not seeing in this room with my client? And asking that question also became some sort of an invigorative process of exploring experientially what are things that are sort of like becoming the sidelines while I'm actively seeing only what is visible or what is tangibly concrete in these interactions. So this also made me think about how language is not just words that are spoken. Languages also becomes the voices in a phallococentric about like the system about like pauses, small cries, small wails, small sighs, and these reactions that are coming out in different forms. And what are these non-verbal gestures that like sort of come out in these capacities? And yeah, these were two things. And another thing is also sort of like knowing that truth would not have a resting ground. Like it's not just going to be this, that there would be also like many forms. And expanding on that was something that sort of helped me function more emotionally in these sessions.
So encouraging ourselves to look at the unspoken, the nonverbal, and what are the emotions underlying, or thoughts too, that are not spoken of. Any other thoughts? Yeah.
Hi.
Hi.
Hi, I'm from India as well, and I'm a PhD scholar and a clinical psychologist, and I practice a lot of schema therapy, and my PhD is also in schema therapy, and I'm working with a lot of clients with cluster C personality disorders. And first of all, thank you everyone for such a wonderful discussion. I think it's been really amazing listening to all of these perspectives, because even within the schema therapy community, we've been having very similar discussions of late, trying to especially look at the Asian culture, because most of our supervisors right now are from either the Netherlands or the US or Australia. And sometimes when they hear about the Asian perspective, they're quite surprised how things can be different within the therapy room, within how you're delivering the therapy itself. One thing that's really helped me has been to have these very open discussions with my supervisor about these differences. At the same time, so schema therapy, even if I leave out schema therapy, in general, these, like in supervision sessions, my supervisor has sort of even nudged me to look into my own schemas and wherein those schemas are coming into the therapy session. And if I'm observing that, to just take 2 minutes to be sort of reflecting on, or just take a minute to sort of reflect on that schema, take a moment for my own self, and then get back to the session. For example, I did notice that since we were talking about family and upbringing and culture, I think every family comes with its own culture as well. And in India, what I'm noticing in my research and within myself, also this scheme of enmeshment, how enmeshed we are within our families, how our family is sort of seen as an extension of ourselves, and how much that can have an impact on our empathic responses, how much we are empathizing with and how much we are not empathizing with. there are these schemas of subjugation, wanting to resign and wanting to willingly resign or self-sacrifice, which was very well present within me as well. And in fact, it's only when my supervisor sort of started noticing it, he started asking me about it, and I started recognizing that within myself. How much emphasis I would place onto family and family bonding and the importance of family. And I'm working with clients with personality concerns, and we're talking a lot about family. So how much my conversations would also then go in that direction of how family is so important, and then recognizing, but is this coming from something that's more personal within me versus for my client, and being able to sort of then reflect on that together with my supervisor. And they also they do emphasize on getting into personal psychotherapy, whether that is chemotherapy or any other psychotherapy. And I do feel that helps a lot, because yes, as much as you can speak to your supervisor, there are these very personal aspects that you would want to maybe get into, in personal therapy and talk about it. So while I think, since we're talking about training, I do think sometimes maybe encouraging trainees to get into personal psychotherapy, whatever form that might be, can also be very helpful.
Yeah, thank you. And I think this is really a good point about, paying attention to about who we are, because the expression of empathy really is a two-person business, right? It's not just, doing what the clients wants, but also being aware of our own expression has to be in some way determined or affected by our upbringing as well. So, paying attention to the interaction piece, the two different identities and our culture versus different aspects of culture, and also family, personal upbringing, personality, can really help us to do a better job in our therapeutic work. Yeah, so I'm afraid we have to stop here because it's 2 o'clock Hong Kong time, but at other places it's a different time. So thank you everyone, and for your participation. I just posted a link in the chat box. Hopefully you can take some time to give us some feedback. And if you're interested to become a member of SPR Asia, please give us your email and we can give you updates and send you newsletters. So when we have future events, you can be included in the announcements. Okay. So thank you so much again, and we look forward to seeing you.